Hello, Facebookers. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois, and
Sandy Westbo from the Infection Control Department.
hi, Sandy.
Hello, Dr. Bird.
So this is week number 4, April 9th, talking about COVID-19 and giving you some updates from here locally at CGH, as well as what we're learning from across the state and across the country and world. Thought we'd do a little differently this time. I know in the past we've gone right into questions. What we're gonna do is a little bit of just a back and forth between the two of us conversation, talk about some things happening here at the hospital, and share those things, and perhaps that'll spur some questions as those of you who are listening in get a chance to hear about them. What do you want to talk with? Want to do the mask thing first?
We're going to do a demonstration on how to properly remove a mask. Since the day after we did our live last week, the CDC sent out the information to the public recommending that you mask in public. So what they didn't do is tell you how to do that so that you don't contaminate yourself or others. So we're going to go through, this is a homemade face mask, probably the ones that you have maybe have loops. There is actual information on the CDC website on how to make masks, so that's a great resource for you to go to. So first thing that you're going to do, you're hopefully putting your mask on at your home. You're going to, I would prefer you would use soap and water, but I don't have a sink in here, so I'm using hand sanitizer.
Right.
And hand sanitizer is a little bit hard to come by right now. So you want to have clean hands before you put that mask on your face. So if you're using sanitizer, make sure that it dries adequately before you put that on. So I'm going to take that face mask and tighten it on the bridge of my nose. Tie the top one. Make sure that it comes down and that it seals tightly here. Okay, so my hands are clean. When I touch that, adjust it now and then leave your hands off of that mask. As you go to the grocery store, the pharmacy, or wherever you have to go, you don't touch that mask again until you're ready to take it off. So when you get home, again, you need to have clean hands before you remove it. So soap and water, again, is my preference. Works wonderfully. Save the sanitizer. Untie the mask. And I don't have paper towels here. My preference is, especially if you are using a cloth mask, is that you don't reuse it the next time you go out. Launder it in between. Some of you I know probably have some masks from facilities that you've bought at Walgreens before. So if you have to reuse them, then you would have a paper towel or a Tupperware container at your home, and that outside of the mask goes down. The outside is contaminated, so that's the area that you do not want to touch. So it's actually fairly simple, but you have to think about the steps as you're doing it, because everybody wants to adjust it.
Right.
And constantly be having their hands up there. So if you do that, you're putting yourself at somewhat of a risk, probably more so than if you didn't have the mask on. That mask is not a replacement for, I'm going to call it physical distancing. I don't like social distancing anymore. I want you to be communicating with people socially, whether it's via phone or whatever. So let's call it physical distancing of 6 feet.
We've created a new term here at CGH. CDC, be aware of that. We really need to adjust your verbiage. Go ahead, Steve.
Yeah, people are, socially distancing is not good for your mental health, so you want to talk to people. So also on their website, they talk about, different ways to make it, so you can view that. I don't need to go over that again. It's a great little video that they have. Any questions about that, please post them if you're not clear on that, and we can answer those.
At the hospital, we kind of, what our fallback is when in doubt, sanitize. So you think in terms of sanitize, mask, even sanitize when you're done, so that way you're clean and you go about your business. So just keep that's kind of one of our go-tos, is just sanitize when in doubt.
And don't share your mask with other people.
No,
And
no.
anyone under 2 years of age should not have a mask on. They can't breathe well with masks on.
Good
so.
luck with keeping it on them too.
Yeah,
That's
or not
good.
touching.
Right.
So that's
Good.
our mask demonstration.
Yeah. Thanks, Sandy. And so Sandy mentioned physical instead of social distancing, because of social distancing causing some mental health issues, and we touched on that last week as well. I did want to throw out to those of you who are listening that at the hospital here we do have something called Ways to Wellness. I'm going to hold this up right here, Ways to Wellness, and so that's what we have here at the hospital. So if you had some mental health issues, you wanted to reach out, there's someone at the hospital who actually, it's through Sinisippi, who partners with us, who helps our patients who are having mental health and or combined physical mental health issues. We'll put some information about that up on our Facebook site and our CGH site, so I'm not going to go to all the names and details, but just be aware of that's another option that we have available for folks during this time. I want to touch on also what we're doing in terms of telehealth visits. So through our clinics, last I talked to them, they had I think at least 70 of our medical staff that were capable of or doing telehealth visits. So definitely something that we are offering as an opportunity for patients to connect with their physicians, nurse practitioners, and PAs during this time as a stopgap until we can get you in the offices again. So if you have health issues that need to be addressed, there's a good chance that you might be able to address those through telehealth visits. So please reach out to your physician's office, and there's a good chance that they would be offering those visits for you to take advantage of. I would also say that they're also doing, in certain situations, some virtual visits, which are essentially telephone visits. So if you reach out and say, hey, I want to just have a conversation with my provider, that's another option that we have for you to touch base. Because we don't want, even though we're trying to cut back and not do elective office visits or procedures or diagnostic testing, we want to have a mechanism for you to communicate with your provider between now and April 30th, when at least right now we're planning on, actually May 1st, we're planning on going back to our full services. Another thing I want to talk about is the emergency department and a tent. If you drove by our emergency department, you might see. You want to talk a little bit about that, Sandy?
Yeah, the tent is in case we would have an influx or a large number of patients needing health care that we could not accommodate in our emergency department or at our Ready Care clinic. So it's just part of our emergency management preparedness, and we hope that we don't have to use it, but we need to be prepared for if that happens. The projections for the state of Illinois at this point, it keeps changing. As of yesterday, it was April 12th or Easter Sunday that the peak would happen. Now today I see that it's April 11th or Saturday. So hopefully that doesn't happen, but if it does, we'll be ready for it.
Right. So that tent, where my understanding is that's going to be operational Saturday. So if you have concern for some COVID-related symptoms, of course, if you're feeling just not the greatest, but otherwise getting by, just stay home and ride it out. But if you have more concerns and feel like you need a medical screening examination, which is what they would do in this tent, then it will be there as an option for you. I will say, so you would go to that tent and you'd have a medical screening evaluation, and based upon that evaluation, you may still be sent home. If they feel your symptoms or your findings warrant it, then you would be directed to the emergency department into the inside of the emergency department for a more extensive evaluation. So yeah, that's where we're glad to be offering that. So I'd make sure I've covered the main things I wanted to hit on in terms of new things that are going on. I think so. So the other thing that we're going to do is, of course, we'll go through our numbers, and these are just the numbers for CGH. It doesn't include other testing that has been done for residents of Whiteside County. But as of right now, CGH has tested 353 people. 320 of them have been negative, and 20 have been positive. Or take that. Yes, that's right. 320 negative and 20 have been positive. So first of all, there's some good in that. And I would say one of the really good things is that we're 97% in terms of getting those tests back now. Where when we started having these calls, I remember being quite frustrated with getting test results back in a timely manner and being able to act on those. And I think part of it is that we have honed down, and across the country we're honing down just to the folks that really need it, and also we've increased our testing capacity. I know in the state of Illinois, the governor, just for the IDPH, is saying that they're having 6,000 tests that they're doing daily, and then there's other outside reference labs that are doing testing as well, so that's making a difference too. So having those tests back and getting them back within a day is very helpful in terms of making treatment decisions for patients, and also very helpful in terms of not using any excessive PPE when we don't know the answer of what's going on with the patient. So that's been really good. The other thing that I'm encouraged by, so when we talked to you last Thursday, my numbers would say that we had, I think, 11 cases that we had tested that were positive. And then we were 12, 14, 15, 17, 18, 19, and then this 20 number. So even though our number of cases is going up, it's not going up, it's doubled, just about doubled in the past week, but it hasn't grown exponentially, which is one of the concerns that sometimes you have about this. So I'm encouraged by that as well. What else did I want to talk about? So, yes. I wanted to talk a little bit about some of the things that I think we're starting to see as a result of this physical distancing, or social distancing is what you may commonly hear, in terms of how that's affecting and bending the number of folks who are getting symptomatic COVID and ended up in the hospital or ending up sick. So I would refer you to, and I think we'll put this on our page, I don't know if you'll be able to pull it up, but it's called Corona Case Counts. Basically it's a guy by Nate Silver, and he goes into detail about this, but essentially, and I don't mean to get too technical, but I'm going to get a little technical, that what we're looking at when we talk about something like coronavirus is the reproduction ratio. In other words, for a person who has it, how many people are going to get it as a result of them being exposed to the general population. And we think it's about 2.6, so about 2.6 people for every person who has this corona gets it. Now, if you're on a cruise ship or you're in a dorm, that number goes up quite a bit. So instead of 2.6, maybe it's 5, 6, because of the close proximity that we are with folks. If you're in a remote town in Alaska or doing social distancing like we're doing, what we want to do is get it below 1, which means that it actually begins to die out. And I'm cautiously optimistic that that is what we're seeing, because when I look at part of these numbers that Sandy's talking about, that we've moved, when we talked last week, I think we were talking April 19th or 20th in terms of the peak. And it is backed all the way down to April 11th right now in terms of the peak of hospital services that will be needed in the state of Illinois. And so part of that change is due to this R factor, this R ratio has gone down because of the amount of social distancing, physical distancing that we're part of. And there's 3 stages in one of these pandemics. You have the uncontrolled stage where you have just that 2.6 for this particular virus. Then you have an intermediate stage where folks are beginning to do some distancing but haven't completely gone full into it. and then there's lockdown, which is where we're at. And a lot of times in those situations, you get below 1, you get like 0.7. And the number of cases lags sometimes the actual what's going on in the community by a couple weeks. So there's a lot of stuff in that, but it's really interesting. And the other thing that's changed in terms of April 11th that I thought was interesting too is they were basing our numbers based upon the peak that they had experienced in China, of what we had seen in China. Now they're putting they're running those same statistics based upon what they've seen in Spain and Italy. And Spain and Italy are closer to us in terms of the reporting and kind of how our society functions. And based upon that, they feel that the cases are it's going to be different because of that. So instead of just using China as the template for how this is going to play out, we're beginning to use other European countries. So Illinois, yeah, April 11th, but here's, I thought was really interesting too, and Sandy, you can speak to this as well. So guess what Iowa's is though? April 27th. And so here's the deal, Illinois, we shut down schools on March 17th, and we did the shelter in place and non-essential business shutdown on 3/21. Iowa, they only shut down the schools and did that April 4th. So when you see their curve in terms of how long things are supposed to last, it actually, ours is beginning to really taper off when you get around the beginning of May. And you look at Iowa's, which unfortunately we're kind of close to Iowa, but anyhow, you look at Iowa's and they're more like toward the end of May when they're starting to see everything finally all the way taper off. So, and I'm not like an epidemiologist, but there's definitely something to what we have done that we've been able to control as a community, as a state, that I think has had a significant part in this first wave, what we're seeing in terms of the infection rate and how it's beginning to peak sooner and hopefully ramp down sooner. Sandy, do you want to speak to that?
I just hope the projections are right, because it is a numbers game.
Right.
So I don't want people to get a false sense of security and start going out into public groups and thinking it's okay to have my Easter dinner. Because if we look at our numbers internally too, cautiously optimistic, the entire month of March we tested positive 13 patients, and already in April, 9 days into April, we've had 7 positives. So, hopefully that trajectory doesn't continue and we don't get a new case almost every day, because if that holds true, then we still are seeing it. So I just don't want people to feel like they can start going out and about.
No, I agree.
Continue to maintain, and hopefully we won't see a surge here. To be hopeful.
Yeah. Matter of fact, those projections are based upon the social distancing through May. So it's like, yeah. So if all of a sudden for Easter Sunday everybody goes, let's all get together, those projections go out the window. So good point, Sandy. I wanted to encourage you. Sandy wanted to discourage you.
I don't want to
discourage you. A little yin and yang here.
I want you to be cautious.
That's right.
Cautious approach in pandemic caution.
Yep, I agree. I'm all for it. Okay, so questions. What do you have there, Sandy?
So the first question that we had posed for us is, what is the time frame for getting quick result testing and for getting antibody testing? So not real certain in what you're talking about quick result testing, so maybe you're talking about the new Abbott test that comes back in 5 minutes, which is the point of care test. So that test is not readily available yet, so we don't have that here, and that test is like the test that you do for rapid strep throat or rapid influenza. It is not as sensitive as these other tests, so you're gonna have some results that aren't quite as good as these other tests. So if you move up one level, then we have the Cepheid, which is the test that is in about 45 minutes, and we thought we were going to hear something today actually from that company as to whether or not we were going to get that test. We have not heard yet. They were sending all of those tests into the big universities and they got a little flack about that, so If we could get that, that would be great. And then the next level is what we're doing. We have LabCorp and Quest, so those are sent into those labs, but we're generally getting those results back sometimes same day or within generally 24 hours.
Yeah.
So the antibody test, my understanding is that within the next month that will be readily available.
Yeah, I hot off the press. I just got off the phone with our pathologists here at CGH. And this, first of all, the great news is that with the resources we have available in terms of available testing facilities, we're down to basically 24 hours, which is really helpful.
It's this.
Yeah. And so, but as far as these other options for these tests that take, 30 minutes, 40 minutes to get back, right now, just being transparent with you, it's looking like we'd have those earliest sometime like beginning of May. So at least we have the 24-hour turnaround. Would love to be able to, we can make better clinical decisions even still if we had a 35, 40-minute test. I just don't think that's likely. I do think a lot of those resources are being diverted to bigger hot spots right now. As far as this immunity test, our pathologists have reached out. They've researched this, and they've reached out to a particular company that they think would be a good fit. Haven't heard back from them yet. And I think we're going to have to run into the same situation where, there's 5,000 hospitals in the country, and I bet you every one of them is reaching out to a company that does antibody testing, trying to see if we can get that together. So I do think at some point in time antibody testing is going to be a reality. I don't see that being a reality. Once again, I'd be surprised if in the next couple of weeks we have something in place for that. It will be helpful though at some point in time, because then you would know if you had an immunity to it, and that's pretty helpful in terms of knowing whether you can go to work, in the community, at the hospital, if you can be around more social gatherings if you have immunity to it. So there's definitely some benefit to that, but we're not there yet. So, and I guess I would just add to that, if I'm hearing that there's a chance that we could have this flare back up again in the fall or winter, and obviously we would hope we'd have immunizations by then, but there's no one guarantees. So having immunity testing just to see if people have the antibodies to this could be pretty helpful in that situation as well. So that's kind of that question right there.
Yep.
What else do you have, Sandy?
So what is asking for a friend who is immunocompromised and has frequent blood draws. She asked me, why is the lab not wearing masks? Also those who are screening at front entry. Well, as of today we are. The whole process for universal masking was phased in. So we did our departments that were defined as the coronavirus areas, where we tried to house those people in specific areas to cut down the number of healthcare workers and to keep them segregated. So there is some education that has to happen with all of this. We rolled that out and then began yesterday universal masking here, so you will see that happening.
Mm-hmm. And I've been reading a lot of hospitals are going through the same process where they're trying to be very measured in making sure that we get to that point, but there's also it's a day-to-day evaluation in terms of where are we at with our PPE supply and all those kind of things. At the end of the day here at CGH, I feel really good about how measured we've been about this, and I can guarantee that Sandy and her colleague Gina have been scouring, not the floor, but different sites, and kind of finding out where are we at with this, what's the latest consensus, what are hospitals doing, and so we have, I think we're in a good spot in terms of, I feel like we have adequate supply of PPE at the moment, and I feel like we've done all the right stuff in terms of keeping our patients and our staff safe throughout this process.
It was just last week where they came out with the data to show that there were asymptomatic individuals that were transmitting. Before that, it was an unknown. So I know it seems like to people, that things happen quicker than that, but
in this process, this is in my career the most I can think of where you have a plan today, and tomorrow you're like, oh, gotta tweak that a little bit. Oh, gotta tweak that a little bit. Every day it seems like there's some new information we're
Right.
learning about how to go about that. Just yesterday I was reading that now these intensivists are beginning to wonder about intubating quite as many people, because with this particular virus, they're seeing some of these patients have low oxygen levels, which would typically be a sign that, we need to intubate this person, but their heart rate's not going up and they don't appear to be more short of breath. And so I think, once again, learning throughout this process that maybe not quite as many people need to have ventilators. So yeah, it's just an evolving thing, and it's been interesting to live through it for you as well as for us. What's the next question, Sandy?
It's kind of the similar, are your employees allowed to wear masks? Yes, universal masking started. If you have a medical provider in your family, is it safe for you to stay with them? I'll throw that one to you.
What do you think, Dawn? Yeah, no, I feel like, once again, our medical staff has been educated on how to go about their day in a way that while they're here, that they're doing the right things to protect themselves, and they're not exposing themselves in any way that would make their risk really go up in terms of getting this infection. So I feel like, when you work in healthcare, by and large, to be around your family, you get home, you have a routine, take your stuff off, put it somewhere, put it in a bag, get it washed, keep your shoes in a certain spot and all those kind of things. I think it can be done. Now granted, some folks don't feel comfortable with that, and we've read across the country where there are some people that prefer to not be around their families during this time, and I completely respect that. I do feel comfortable that you can go about your work and here at the hospital, even now, and still be around your family at home. And I just would throw this out there, not saying this is, I don't have the data to support this, but the hospital, man, we are set up to try to keep people safe. And in terms of the PPE we have and everything that we do, sorry, I got my hand a little bit moved in that direction.
This says that we're not 6 feet apart.
Okay, I know, we're trying. But when you go to the store, there's a lot of opportunities to touch things. Or if you're going to go to the bank and do where you put the thing that goes up that chute, where you have to be pretty careful. I mean, not that you can't do those things, obviously, but you have to really think about that. So there's opportunities to get infected, I don't know, just as easily, but there's opportunities to get infected other places besides a hospital. Anything else you want to say about that,
That
Sandy?
wasn't your wife that submitted that question, was it? No. I feel safe here. I mean, we've been screening people, and we have protective equipment, and, I agree. The community just last week started limiting some of the stores, the number of people in, so.
I think everyone's learning,
I think,
businesses included.
they all
Yeah.
get to that point, so.
Yeah. What else do you have?
What are your thoughts on the virus spreading through the air and being contagious in that form? My thoughts are that what they're telling us, at least at this point, is that it is droplet, which is close contact, versus airborne, unless you're doing medical procedures that would make it airborne. So in the community, that should not be a problem. It's pretty much related to medical procedures.
Right. Yeah, I mean, okay, if someone sneezes, like just right in front of you and just lets it rip, okay. But by and large, if people are just they're talking like I am, I feel comfortable that if we're talking droplets and we're talking 6 feet by and large. What else do you have, Sandy?
I had a question sent to me actually via email. Is expired hand sanitizer still good? Well, hand sanitizers generally expire about 3 years after they're manufactured, and they do lose some of their capability after that point, and once it drops the alcohol content below 60%, then they're not protective. So like if you're starting out at 70, I don't know how long it takes to get to that 60, but there is a reason why those do expire.
Yep. Good. can you launder the mask in your sink versus washing machine?
Well, I would say if you don't have a washing machine, you have to come up with an option, but the preference would certainly not be that you did it in your kitchen sink. So, if that's like the only place you have, you could do that with hot soap and water and then sanitize the sink, but the washing machine would obviously be preferred, and you have the agitation of the machine also.
Yeah. Is there a case of COVID-19 at CGH? I think we've answered this one in previous weeks as well, and throughout this pandemic, we don't go into details about any particular patient, obviously, but we continue to have folks who are either what we call PUIs, persons under investigation, or positive cases that we have treated here at CGH and have continued to do so. Let's see here. Where exactly is the tent? So if you know where our emergency department is, it's just outside of there. So head to our emergency department, which faces the high school football stadium track, and right outside in that parking lot is where you would see the tent.
It adjoins 2nd Avenue.
People have been saying if a child contracts and is hospitalized, the parent can't stay with them. Is this true? No. So we have a minor, we're going to have minors need supervision. So that would be a different situation. Next one is a comment, and that is, I miss the cafeteria. So do I. I got the salad bar every day. So I'm no salad bar. I think I'm lettuce deficient right now. So yeah, we'll. By the way, for our cafeteria, just a shout out to them. First of all, they are for our employees. It's not like every employee, but as many as we can. We're actually our chef is making hot meals and sending them home with our clinical staff when they go home at night. So pretty cool stuff. And the other thing that I shout out to our dietary staff. So when we have these masks, we don't want to use a bunch of them during the course of the day. And what we do is I would foam and then take my mask off and put it in a little brown bag, and then foam, and then I'd carry my little brown bag around until I went to the next department that I needed to wear the mask for. The dietary folks actually figured out that you could do that with a kind of like a sandwich, styrofoam little, yeah, so it kind of opens like that and then it closes. So now, when I'm going, let's say I go into 2 East and I put the mask on, I take it out of my sandwich thing, put the mask on, and then sanitize, and I go about my business there on the floor where we have the suspect COVID patients and positive patients, and then I put it back in this, basically a sandwich thing, and close it. And it's really slick, so our dietary staff, in the course of just kind of learning about this, figured that out. So it's fun to see how folks improvise and find ways to try to help out during this situation.
Here, I thought you had Starbucks in that brown bag.
No, and someone thought I had like an Easter gift in there, and I'm like, nope. I have a little mask for in there. So, okay, what else we have? Oh, wow. Dr. Bird, what is your opinion of using quinine? I think that's probably you're talking about that anti-malarial drug. So, my opinion would be if we had someone who was getting really sick here at the hospital and kind of getting worse, and they otherwise were healthy, and we thought that they wouldn't have any reactivity to that medication, I think I would be open to having a patient try that medication. So I wouldn't take it like just if you were at home and had symptoms, but otherwise were kind of getting by. I definitely wouldn't take it then. And yeah, it's select hospitalized patients, and I would let our intensivist kind of make that call, or an ICU doctor. But yeah, that's kind of what I would say about the anti-malarial medication. I know that there are companies, there was like 250 companies that I last heard that were either working on a vaccine and or treatments, drugs to treat this this infection. So I know we'll have something eventually even better than this anti-malarial drug, but that's my answer on that. How far are we in getting convalescent plasma? We're getting there. So the deal on that, you can chime in if you want, Sandy, but the deal that I've been reading about this is, so to be a candidate to donate blood, to be able to be used for this process, so essentially if you get the infection, you're positive, then you do develop antibodies eventually, and those antibodies can, in theory, be taken from your blood and put in the blood of someone who has a COVID infection to treat their infection. But the time frame is you have to be 28 days after being asymptomatic. So in other words, you have the infection, you don't feel the greatest, you get the test, yep, you're positive, not even a candidate until about 28 days after that. So our first case was around March 13th or something like that, if I remember right. So if you do the math on that, we're barely there or not quite there even for that initial person, and that doesn't even, and all the other blood bank rules apply, so I don't even know anything about any of our people that have tested positive, but they still have to meet the usual blood bank criteria. I say that to say that I think it's an interesting thing that we are exploring and looking into, and our pathologists are talking with our blood bank about that. I don't think it's live for prime time here quite yet. So I think we're getting there, and I think at some point in time we'll have that. Not quite yet. And it's listed under something called IRB, which is like an investigational drug. So in other words, certain things we let physicians use because the FDA hasn't quite approved it yet, but the FDA thinks that, well, if they weigh the benefits versus the risk, the benefits are greater than the risks. So yeah, that's a long answer to that short question. Sandy, anything you want to add to that?
We're nowhere near that at this point.
Okay. Let's see here. Let's see. You will need to have the antibody test. We need to have the antibody test before you get a vaccination. When will there be a vaccine? I don't know. I'm not sure. Most of the time with our vaccinations, you don't do antibody testing before you get the vaccination, so I kind of doubt it.
Yeah.
But I don't know for sure yet. Let's see here. So let's see. This is kind of in that vein of should the masking have been done before now? The universal masking. What would you say about that, Sandy?
I again feel that we looked all along, at what the literature said and what was recommended to do, and until they had data to show asymptomatic carriers that we really didn't have good solid data to support that. And just as I showed you how important it is to get a mask on and off appropriately, it's the same thing for our healthcare workers. Because if you just handed masks out and said, here, everybody mask, you have to learn how to do it appropriately. So there, again, tremendous amount of education needed to get that process done. I just feel like we did.
Yeah, I gather from the tone of the question that someone doesn't agree. Okay, I respect that opinion. I would say though that we've been working really hard and every day having conversations about when is the time to do this. We're not Chicago, we don't have the same number of cases, we don't have the same prevalence in our community. We want to keep our employees and our patients safe. We want to think about how much PPE we have available to us and how we want to make sure it's going to be able to last. All those things play into those kind of decisions. So completely respect those who would feel differently, but I feel really comfortable with where we're at with our PPE usage here at CGH.
We had to take a look at if we did peak April 20th or, at those times, how much masking would that take for the employees that we have working, and we needed to be prepared if we really did have a large influx of positive patients to certainly make sure that we could protect everyone.
Yeah, that's a good question, though. Okay. Universal masking guidelines say staff have the option of using a single mask that may be worn continuously. Yes or no? What would you say about that, Sandy?
I'd say that, so there's certain areas in a hospital that we don't consider clinical areas generally. Hallways, getting back and forth in between areas where there are not patients.
If you're in the business office.
When you can be spaced out 6 feet from each other, then yes, it is an option. In clinical areas, then the healthcare workers are wearing them. So I guess that's a kind of between yes and no. It depends on where you're working.
Mm-hmm.
So when I'm in my office and I'm the only one in there, I don't have a mask on, or when I'm walking down the hall and I can stay 6 feet away, not going into those areas, I would feel like that would be an unnecessary use of a mask that someone else needed. So
yeah. So definitely in the clinical areas, we're like, wear a mask. If you're in one of those other areas, we kind of give you 3 options. If you feel like you're going to be 6 foot apart from each other, you don't have to wear a mask in those areas. If you want to, we're offering anyone who wants to wear a surgical mask in those areas that we'll provide one for them that they can wear. They're more than welcome to do that. And if they want to bring a mask from home just to conserve the surgical mask that we have here, they can do that as well. So they have 3 options for those non-clinical areas. In the clinical areas, it's pretty much we're going to say wear a mask until this whole situation's over and done with. Hope that helps that question. We have Sandy.
how safe is it to come in for a scheduled appointment and to the lab? You know, I think that we've talked about those measures that we're doing here to keep people safe, and if it's an appointment that's necessary for your health care that's been determined by your practitioner, then I absolutely feel it's safe to come in for that appointment.
It's safer to just hang out at your house. And just like it's safer to not go to Kroger or County Market, but there are certain things we have to make a decision about doing or not, and I can guarantee you, when you make a call to whoever your physician is and say, here's my situation, here's my issue, as well as you thinking that through, I guarantee you that medical staff, that physician, nurse practitioner, physician assistant is thinking through, okay, here's what I'm hearing about this patient's concerns, questions, condition, underlying medical problems. Here's the benefit of them coming in, and here's the risk of them coming in. Which one of these should we fall on for this particular patient? So every one of those decisions is a unique one for every patient, and our medical staff I can assure you they are taking this very seriously about who do I need to really have come in here and who can wait. But that's not a just black and white answer. But I would feel safe if your doctor felt like that you needed to come in here. I'd feel comfortable coming in here because we're doing all we can do to make sure you're safe when you come in. And thanks, Dana. And Dana just reminded me once again, I talked about this earlier in the podcast, we do have telehealth visits. So there are a good number of patients who can have their medical problems addressed via that telehealth visit. So I would encourage you as you make that call to be aware that that's another option. But sometimes you have labs that need to be done, other diagnostic testing, and we're still doing all that stuff. So we're doing it when it's clinically indicated. Is a viral video going around on Facebook of a physician suggesting people drink tonic water for the quinine and to take zinc for your immune system? Is this something that can help? Well, Sandy and I would not know because we're not on Facebook. But if we were on Facebook, I would
Except right now we are.
Yeah. But if I was on Facebook, I would say, no, I don't think that's a good idea. So I don't know. All I can say is no, don't do that. Sandy?
I would steer you away from Facebook getting your medical information in terms of coronavirus.
Other than us, of course.
There are several things that were posted on different, Facebook pages, and one of them was something that you put in a fish aquarium, and there was a couple that drank that, and I think one of them died, and the other one was extremely ill. So look for evidence-based medicine sites that you can validate those kind of things. And are you trying to prevent infection from the virus? And if so, again, spatially distancing and masking in public and hand hygiene. That's your best answer.
It is. Okay, I think we're going to call it a day. Those of you out there who have been listening to us and are going to listen to us as we're recorded, thank you for listening in. We'll plan on doing this next week. So as you go throughout the course of your week and you have questions, you can send those in and we will address those as you have them when we talk next week. So until then, Sandy?
Happy Easter. Wait to have your egg hunts until the weather is nice and we're through the pandemic.
Agreed. Thank you. Thanks for listening.
Ooh,